that just finished, and that was facilitated by Beth Schlachter. And so I'm going to invite Beth Schlachter to come up to talk about that plenary and how it can inform the vision for Beyond 2020. And this session is going to provide input to the work of the FP 2020 organization. So please, Beth.
Thank you, Amy, and thank you for inviting me to weave the two plenaries together. When we were offered the opportunity to host the plenary this morning, we wanted to do two things. We wanted to give you the opportunity to hear how some of our interventions and approaches, some that have been tried and true and traditional, and some that have really come to the forefront over the last few years, how these interventions are really helping to shape new opportunities for women to have access and choose to use contraception. We also then wanted to think globally and about the sort of global architecture and how that framing has an impact on how countries shape their own programs and their goals, so that together we could feel these country interventions, the global architecture, and how political will, advocacy, and the drive to meet the needs of individual women and girls are at the center of all that we do. We all know we're at this moment of almost at the end of 2018, and that we are FP 2020, and the end date is baked into the name, and that at this point in time, it's our opportunity to think together and to learn and to build together for what we all want for partnership going forward. I'm very pleased that there is a commitment to defining a partnership and that we will keep the momentum of this movement going forward with all of the work that you're already doing, but with this partnership overlay as well to support and help inspire and move things forward as a supporting sort of mechanism. So I'm very happy to be listening to what our panelists are going to be discussing today about how we might do that. We're launching a global consultation that'll really start in earnest at the beginning of the year, that'll give an opportunity to everybody to share your perspectives on what you would like to see from a partnership going forward. I really commend those who built the FP 2020 partnership really quite quickly in 2012 to capitalize on this moment and to ensure that there was a secretariat and a partnership and a process to take forward that momentum from 2012. We've learned so much since then, but there's a lot more to learn. And together I know that we'll shape this next iteration of the partnership to have high impact and to be as supportive as possible for all of you working in countries to move things forward. So with that, I'm going to take a seat and listen to what you're all talking about as well and what you'll share with us. So thank you.
Thank you, Beth. I presume you all know what bending the curve means. It's bending the curve to be able to provide access to all women and men who might desire contraceptive services and information. It doesn't necessarily mean that contraceptive prevalence as a rate has to go up to 100%. It can't go up to 100%. But it does mean that it takes the efforts of many. And it's not just the efforts of the leadership that is at this conference, whether you are under 30, under 35, or over 65, but it does mean, that it takes so many to be able to provide the tide that lifts all boats. So this session recognizes that the decade of 2010 to 2020 was a memorable period in the history of family planning and global development as a whole. In the 6 years since the FP 2020 commitments were made at the September 2012 London Summit, the world has already reserved a remarkable increase of over 38.8 million additional users of modern contraceptives. But bending the curve means many more of the 120 million that were originally estimated in need of contraceptive services and information are to be reached. So the conference, as you know, exhibits tremendous energy, has shared a huge number of best practices, evidence, sharing knowledge, sharing expertise, and I can't imagine that this conference won't help bend the curve. To assist us in this mission, we have five distinguished panelists, and the format of this session is going to be that I am going to start by asking them a general question about their vision for Beyond 2020, and then we will follow that with individual questions to address their expertise, and then we will end and hopefully have sufficient time for Q&A from the audience, and that is important. An important part because we are providing input to the FP 2020 coordination of the Beyond 2020 meeting. So with that, let me introduce the 5 panelists. I start with the person who was on my right, Dr. Julia Bunting. She is the president and CEO of the Population Council. If you were here in this room last night, you would have known that she won the FP pitch for advocating for male contraception. It was very, very impressive. The next person to my right, Julia, you have changed. So the first person to my right is Klaus Brill. He has been the Senior Advisor and Vice President of Global Health Programs at Bayer AG, and is also on the Executive Committee of the Reproductive Health Supplies Coalition. Then Julia Bunting, and then our original youth panelist was unable to make it here. Her passport was taken from her unexpectedly. Stolen is the word. And so standing in to replace her, but with equal vigor and knowledge, is Dr. Jean-Christopher Rutsatira, and he is currently with the Gates Institute. Dr. Rutsatira is a MPH graduate from Hopkins, but he is also a Sommer Scholar, which is one of the most distinguished types of MPH alumni we have. To his right is Dr. Zaharallah Abdullahi, who is newly appointed State Minister of Health for Ethiopia, and she has also this distinction of being one of the first female ministers, so welcome. And to her right, another distinguished panelist is Dr. Fatimata Si, who is the coordinator of the Ouagadougou Partnership and also based at IntraHealth International. So thank you very much for taking the time and accepting the invitation to serve on this panel. I'm going to take my seat over there, but before I do, I'm going to ask each of you going down this way, and then the next time we'll come this way, to tell us what is your vision beyond 2020? What is the one most important factor? You have 1 to 2 minutes. This is an exam. As you know, I'm a professor, so I get to do random quizzes. So Dr. Brill, will you start?
Is it on?
Yes.
Yeah. When I look into the future and what comes to my mind, what we should accomplish within, let's say, not the next 10 years, because I think family planning will play a role as long as human beings existing. So we can talk about 2120 or what you have 2020, 2022. It doesn't matter. What we need to do in the future is to build more strong partnerships, because I'm a strong believer into partnerships. From a manufacturer point, I think all companies producing reproductive health products, be it research-based companies or generic companies, are prepared to deliver what the demand is. And we have to talk about, have we good figures about the demand? Here, an initiative by the Reproductive Health Supply Coalition, the Global WAN, can help to better understand the demand, to better understand what is needed when we talk about method mix, and how to make supply more efficient and more safe. I think these are one aspect. When we talk about products, we have a variety of different methods which I think feed the demand. What needs to be done, maybe with the support of manufacturers, is in terms of education young girls and boys about their reproductive age, and to make access to information about reproductive health. I think this is very important, that people can build their own mind and that teachers are well trained to educate young girls. This is, I think, something we have to think about much more for the future to make our vision happen, that everybody has access to modern contraceptive methods.
Thank you very much. Julia.
Thanks, Amy, and it's
Can you bring the mic closer?
Thank you, Amy, and it's a great privilege to be here. As some of you know, I was one of the architects of the original London Summit on Family Planning back in July 2012, and I think it was clear to all of us at the time that we came up with a construct of 120 million additional users by 2020 that it was only a milestone. It was a discrete and time-bound aspirational goal, but it was a milestone onto what we all believed we wanted to see, which was universal access. And of course, we're fortunate that the UN Sustainable Development Goals now has that target of universal access by 2020. So my vision is that's what we need to continue to maintain the momentum that Beth talked about as we move there. As we move towards universal access, we obviously need to celebrate the incredible progress we have made. As Amy said, we have shifted the curve. 46 million additional women, men, and young people now are using modern methods of contraception that they weren't using back in 2012. And of course, we've continued to sustain the hundreds of millions of people who were already using, and that's a really important thing for us to be aware of. But as Beth said, we've also learned a lot of lessons along the way. We've got much better data, we've put in place much better systems, and we need to really now use that to further shift the curve towards universal access. And I think as Beth herself has said in the past, there is no road to universal access that does not go through 120 million additional users. And so whilst current projections are that we're going to miss the 2020 target, and we all acknowledge that, there is no road that doesn't go through 120. In terms of the area of focus, I think for me it will be about expanding the partnerships. I think we still recognize that we often fall into the trap of thinking about family planning as a health intervention. And we saw that and there have been discussions here this week, including on the demographic dividend and thinking about how family planning contributes to poverty reduction and economic growth and development. But we still need to continue to expand that network, to expand the people who are interested in these issues, for whom family planning helps them to achieve their outcomes and not ours. And that's a really important way of how we think and talk about it. But people interested in education, people interested in environment, and as I said, poverty reduction, economic growth. Family planning is a best buy in global development, not just a best buy in health.
Thank you very much. So Chris, your one most important focus in the vision for Beyond 2020.
Thanks, Amy. Looking at the progress that has been done in family planning, I hope that beyond 2020, or even starting from now, we can turn family planning programs into a social movement where we have family planning programs driven by the beneficiaries, by communities, particularly youth, and not necessarily depend on the donors' priorities and donors' requirements. I hope that building on the experience that we've seen in the role of youth and how great they can do if they are given the responsibility. For example, you saw yesterday in the plenary how they took responsibility and actually delivered one of the most powerful plenaries that ICFPS probably has ever experienced. I believe that moving beyond 2020, we can really integrate young people into the planning, the development, and the implementation of any kind of family planning interventions, and at the same time look at what is it that actually will we as the community get out of their contribution or their participation in family planning programs, in matter of the benefits or that we can get from their access or universal access to family planning, and what are the benefits and what's the value to their communities in matter of well-being, in matter of health benefits, in matter of economic benefits, in matter of security and environmental benefits.
Thank you very much. Honorable Minister Abdullahi, what is your vision beyond 2020 and the one most important focus?
Thank you. Ethiopian visions in family planning will be beyond 2020 to see all the family planning demands are met, choices are respected, services are provided in a compassionate and respectful way. Inequity between segments of population is addressed, and we continue to provide financial protection to the user in order to create a productive nation and harness the demographic dividend. One of the most important focuses in the Ministry of Health in our country will be to expand access and utilization and sustain the gain made so far, as well as addressing the unmet need and equity to all second population without leaving someone behind, as we continue to the committed to increase the magnitude per capita income on the health with emphasis with the domestic finance in the global and multi-sectoral partnership will continue to the most important asset towards the realization of the SDG development goals.
Okay, thank you very much. And Dr. C.
Thank you, Amy. Thank you for involving us, in this reflection and start thinking about what and how our movement could be beyond 2020. We are here because we all believe in the 2030 SDGs of ensuring universal access to sexual and reproductive health and rights services, including for family planning. And what is great is that we know what to do. Dozens of high practice interventions have been identified to rapidly improve reproductive health services for women and girls. We know how to do it. These interventions have been piloted in many countries in various contexts. And we know where to do it because we have mapped exactly where lack of information, services, rights are hampering our population almost to the household level. And there is a willingness and shared desire to reach our goal. Billions of US dollars have been so far expended, multiple commitments made by governments, and engagement never seen before by civil society entities. But yet, we have not reached our goal. And for me, this is not government fault, not donors' fault, not implementing partners' fault. I think our failures is largely one of coordination, not efforts, because we worked hard, this past year to make it happen. But how did we do for coordination? So for me, during the consultation that we're going to engage in the near future to think about beyond 2020, we need to pay a special attention to coordination and collaboration. And I think it should not be just a wish or a slogan. I think we need to frame this coordination. We need to define strategies for this coordination. We need to look at what we need to invest in this coordination to make it happen, to make it specific, and to think about even measurement of this coordination so that we come up with a very tangible outcome and result. So for me, paying attention, beside of youth inclusion, beside of pushing health, family planning beyond health sectors, etc. But coordination should be also something that we need to pay attention to during this reflection. Thank you.
Thank you very much. So these 5 distinguished panelists have given you a formula, and from what I have heard, and maybe this is selective activity on my part, is from Dr. Brill, partnerships, generic production, and also the need for demand and educating youth. Nobody really answered one. Everybody gave me the richness, and that's the richness we need. From Julia Bunting, the one I selected was the demographic dividend and family planning being a way to lift people out of poverty. From Chris, family planning programs, youth, addressing youth for the present and the future. And from Dr. Abdullahi, the importance of choice, importance of good service provision, the importance of access. And from Fatima Tasai, coordination of what we already know about best practices, the knowledge we have, and the importance of measuring how we go forward. So Beth, now you have that first set of input. All right, now I'm going to ask each person specific questions related to their expertise. So I will start with Fatimata, and I presume your response is going to be a little bit different from what you've just said. But as you know, networks and consortia with common goals can be very powerful forces for development and change. As the coordinator of the Ouagadougou Partnership, what do you see being the role of Southern networks like OP in advocating and accelerating universal access to contraception?
Yeah, the Ouagadougou Partnership is a platform designed to accelerate progress on family planning in the West Africa region, and it is recognized that this region was one lagging behind in many of the reproductive health and right indicators. It is a partnership between countries that face with common issues and share social norms. What is interesting in that it gathers, government, donors, private sector, parliamentarian, civil society organization, including traditional leaders, religious leaders, youth. But what is interesting is gathering them all around a common goal, but with a clear definition of roles and responsibilities. And what we have learned since we start this partnership is that progress on family planning is most achievable when countries, donors, CSOs, implementing partners share information and best practices, coordinate funding and interventions for high impact, and collectively advocate for global attention. And what we have seen is that because of this partnership, in just 6-7 years, more women have begun using family planning services during more than during the 30 past years, and this is extraordinary, and I think it's a big achievement. I think this type of partnership, this type of network can add value to what countries are doing and also help us as the community to improve the way we are doing business. I'm taking just a few examples for that. In terms of the momentum around the family planning, and this is something that we often don't measure. It's just the momentum in here. But I think this is important because it requires a lot of effort and need to be also seen as one of the indicators of success of what we are doing. And this kind of partnership can help maintaining the momentum over years, which is excellent. The other example of role that this partnership or network can help doing is to have to facilitate the regional policy change that can benefit to many countries, regionally and collectively, taking, and we have some examples on that. The other thing that I saw as something that is important is the alignment of donors' investment in country priorities. I think this is something we are talking about, alignment, and the fact that donors, we have, this platform and even a sub-platform where donors can discuss, share information in a regularly basis, not just, meeting once a year or twice a year. It's really a platform within this partnership with clear activities. For example, something that we are achieving successfully is the Donors Caravan. Donors Caravan is taking, the group of donors and having them to travel in countries, stay in the countries at the same moment, same time, and speak in the country with all the stakeholders. That provides them, a better sense of how they can better articulate, their things. So I think a lot of things that we can talk about. Sometimes we are asked about our formula, but I can get back to that, later on if I have the chance. I think this kind of partnership can be transferred somewhere else. And 3 things you need to pay attention to is a partnership to be successful. We need to have a roadmap, meaning that the common goal among all partners to what must happen, an engine or a backbone support organization to keep everyone on task, and then what I call the gas. The gas is the incentive for partners to join and to remain in the partnership.
Thank you very much. So I hope you are able to take up a challenge for a Central Africa partnership someday, whether it's the Yaoundé or the Kinshasa or the Brazzaville partnership, and bring their wisdom to it. Honorable Minister Abdullahi, Ethiopia has moved quickly towards universal access to contraception and other health sector goals. Can you talk about what your country's plan is for beyond 2020 in terms of achieving universal coverage or universal access to contraception, and what major opportunities and obstacles do you envision still encountering?
Okay, thank you. To pursue the post-2020 family planning, Ethiopia will continue to work.
Move the mic closer to you? Thank you.
It takes a second.
Ethiopian to work to continue the family planning service, the major part of the essential health service packages. Through this, we will continue to look in the innovation ideas in the technology and health to help to improve delivery and utilization, and to engage the community in participation of and ownership of its own health using the voluntary community mechanism 1-to-1, 1-to-5, and even to linkage with the health extension workers. So to expand even the access of the long-acting family planning processes like IUCD, and implement to improve informed choices to access. And the second thing, improve the accountability of political and administration leadership as well as the community, where by giving, we are planning to do the community scorecard. So this is one of our major targets, to get the leadership and even the community to get the accountability process, and to increase the budget for the family planning and increase uptake of long-acting reversible methods. So, and scale up of delivery services in the hard-to-reach groups, expand user-friendly and with a focus on adolescent girls. And the most important opportunity now in the country is recently Ethiopian has made 50% of the cabinet to be a female, and had got the first female president, and as well as the first female president of the Court of Law. So by this is one step of to get the leadership to have. Thank you. So we, as the Federal Ministry of Health, we are scaling up these opportunities to our hospital CEOs at least by 50%, and we are cascading the health centers to achieve and to bring women in the leadership position 100%. So this is our main achievement. So in this process, among this, the policy would be mobilized and disruptive in the change of in family planning. So this is one of our opportunity, and the increment of the illiteracy also one of our opportunity. As a challenge or obstacle, if I would like to remind, one is funding for family planning continues to be a challenging. So we need to use another way by like collaboration into and looking in community-based health insurances and like a sin taxes and social health insurance and other forms of fund like a domestic financing. So the other obstacle will be the intersectoral collaboration to harness the demographic dividend. We need to significantly effort to the country. And the other will be the quality data, and the use of data collection will be one of the matter and the challenges we face in the coming 2020.
Thank you very much. I'm sure under your leadership, many of these challenges will disappear. So Chris, you're a doctor, a physician, MPH, a reproductive health advocate. You're also one of the 120 under 40 leaders. After 2020, you'll be an old man.
I'm already an old man.
But as an entrenched member of the new generation of leaders, tell me what you think you and your peer leaders of today will do that is better than what the current leadership generation has been doing or has been able to do.
Yeah, thanks, Amy. Thank you for reminding me that I would be old in 10 years to come.
Old is good. Take
I
it
believe,
from one who knows.
You know, the younghood only dies if you let it die. So I think it probably will remain that way. As I start saying, I really think moving forward, we need to promote mechanisms and interventions that will turn family planning into a social movement. And you may all ask, how do we do that, and what would be the benefits of doing that? I think we've done a lot in matter of helping women, young girls, young boys to access contraceptives. But how do we make it acceptable within communities where the norms are very restrictive? I believe that unless we make it acceptable to anyone, any young girl who wants to use contraception, they feel free to get it anywhere, whether in private sector, at the public hospital, or even within their families. If then they can feel comfortable to have, if they have contraception, they don't feel like they have to hide it. And in that case, I believe we will have made a good and a big step in matter of bringing family planning into the general discussion as we discuss all other matters, and allowing women to make their own decisions. For example, when at what interval do they want to have children, and also that will turn into more of a unified community decision from individual decision-making power and abilities, and without that feeling of being scared of how does the community looks at you, and if, for example, you are a young boy, you are 17, you are 18, you have a condom, what does it mean, or how do your peers look at you if they see you with a condom? I always tell this story. In my high school, it was in a preschool. I think the norm was that if you were caught with a condom, it was probably immediate exclusion from high school. I don't know whether it's still the same, but I believe that such issues happen in many places, and unless we change that understanding and that kind of misbelief about contraception, I don't think we would be able to make the largest steps as we want to make it by 2030 to achieve universal access to contraceptives.
Thank you. When you're old, I hope you remember all these reflections, and they have become a reality. Julia, I'm going to go a little bit off script. Your original question was to talk about thinking about directions beyond 2020, and I think you have. But I want to pose that as the president of Population Council, one of the oldest international non-governmental organizations, one of the leading population research organizations, and one that has been heavily involved in contraceptive development since the beginning and has several successful methods that are now entering the market, how would you talk to Klaus about what to do to make access with youth much more extensive?
So as I sit here today and I think about where I've come from, I think we are at a pivotal moment in contraceptive R&D because the choices that we make now are going to play out for the next 10 to 15 years. And as you said, Amy, the Population Council has been at the forefront of developing contraceptives for more than 60 years. It was Population Council researchers who, back in the 1950s, before the birth control pill was even widely available in the US, let alone around the world, recognized that taking a pill every day was not a viable option for all women. And so they went on to develop, or as I like to call, they conceived, my little pun, they conceived the field of what we now know as long-acting and reversible contraception. So they developed things like the copper IUD, Paragard. They went on to develop hormonal intrauterine systems. They developed technologies for contraceptive implants. Some of these are under license with my colleagues at Bayer, Jadel and Mirena. Many of us are using these products. In fact, we estimate that some 170 million women around the world, that's more than 1 in 5 of all women using modern methods of contraception are using a product developed by the Population Council or based on our technologies. But I think we recognize that those products are not sufficient. We know that many women will discontinue use within the first year of trying a product. We know that about 38% of all current unmet need is for women who have used but are no longer using a product. So we need to adapt existing technologies and we need to develop new technologies that meet the needs of different women, of different men, of different young people, and at different points in their life cycle. So what excites me is about the work that we're still doing as pioneers in contraceptive R&D. As you noted, over the summer, we were delighted to have the US Food and Drug Administration approve a brand new contraceptive. This is a 1-year contraceptive vaginal system that contains a new chemical entity, nesterone and ethinyl estradiol. And what's exciting for me about this product is that it provides protection over 13 cycles, 1 year of protection with a single ring. And it doesn't require cold chain storage, and it could be a game changer for women who don't have access to functioning health systems, who don't have refrigeration, and who want a discrete method that they control. It provides, for me, it provides women-centered control, it provides convenience, and it provides more method choice. But we still don't have enough, and so you'll have heard, as you mentioned earlier, I did the pitch fest last night, and the winning pitch was around a novel male contraceptive gel that the Population Council will be beginning to trial later this month with our partners. And this is also contains nesterone. It's a gel that men can apply and has the potential to offer for the first time an alternative to condom, vasectomy, withdrawal, and of course abstinence, as currently the only contraceptive options available for men. So we're excited about that and think it can be a complete game changer, because we recognize at the moment that about 50% of the population bear almost 100% of the responsibility for family planning, and we need to give men options if we really want to accelerate progress towards gender equality. And the final piece I will say is also actually announced yesterday was a new partnership with the Children's Investment Fund Foundation based in London, who are going to be working with us to develop a contraceptive multi-purpose prevention technology. It's a big mouthful. So this is a really exciting product where we're going to take an existing oral contraceptive pill and co-formulate it with an existing pre-exposure prophylaxis to provide combined HIV prevention and prevention against unintended pregnancy. And what's exciting for me about that is that has a real potential for adolescents. As we know, the face of HIV is becoming increasingly young and feminized, and we know that young women have a high unmet need for contraception. So a combined product that meets both those needs has the potential to be a game changer.
Thank you. Thank you. So Klaus, you have long-standing expertise in the pharmaceutical industry, most recently Bayer AG, and represent the manufacturing sector on the Reproductive Health Supplies Coalition's Executive Committee. Without quality products and predictive availability, you have said that there is no program. That is, this is the role, if there is no manufacturing, there is no program. This is the role of manufacturers. What one investment by the Manufacturing Committee do you want to see for achieving universal access beyond 2020? And I will have a follow-up question for you.
I think what manufacturers has contributed within the last couple of decades is expressed in the progress we have made in terms of access, accessibility, and affordability. And when you look how many products has been now pre-qualified by WHO, this is a big success. And I think we have to motivate more manufacturers to come into the market to get the competition right. What I think might be a very good investment for the future is that beside the public health service, manufacturers can provide and build a private market business, because this would be more sustained compared to a donor-funded health public system. The question here is how we can achieve that. And I think here we have to work together with organizations, be it NGOs, be it governmental organizations, and in particular we have to talk with countries and their authorities how to get the regulatory environment right that manufacturers are willing to invest. Because when you build a private market, you have to invest. Maybe you get not the return of investment within 5 years. But you need to be sure that the environment is there, that every investment is well done. That would be one aspect. Another aspect is to capture on the knowledge manufacturers have in terms of marketing efforts. I think here we have to see how we can work together in terms of knowledge increasement, because manufacturers offer a lot of information around products, the therapeutic field, and the advantages and disadvantages of products. Please don't forget, when we talk about hormonal contraception, we are talking about a highly effective method which has advantages and disadvantages. And we have never to forget how important it is to do good counseling. And I think sometimes I have the impression we have to better partner with medical associations like FIGO or the Europeans in terms of providing the right information for physicians they give to the patients. This is really important. And my third point, and I get never tired to mention it, is all about education. Because boys and girls didn't know what is on. They have to be trained on what makes their body changing when they enter the reproductive age. And I said it 2 days or 1 day ago, every day 400,000 girls entering the reproductive age. And they didn't know nothing about it. So these three aspects, I think, for the future are important. And as long as manufacturers have a demand they can rely on, they will produce. I think there will be no shortage in producing products if they are quite convinced that there is a market. And, you know, this is what makes, let's say, the business running.
No consumers, no use, for sure. And in our own research, we have seen, in terms of youth demand, very, very high consumption of EC and condoms, which seem to be the leading methods for that generation. So if everybody's nodding their heads, this is common knowledge, and this is where there's an opportunity to pass on more information. So I would like to return to Chris. And Chris, now you can put on your youth hat. And you can imagine yourself in 2050, and you have a 16-year-old daughter. What are you going to tell her about what her reproductive health and universal access to contraception is going to be like? What will you tell her? Where will she go to get her contraception? Are you going to tell me she's not going to be sexually active? So just fantasize beyond 2020 and thinking about your daughter as representing the millions of young people then in 2050.
Yeah, thanks, Amy. Maybe I will change the question a bit. I think that there are already parents here with 15-year-old daughters. So I think we can discuss that. What do they tell them? And whether they are comfortable telling them, because I think there is that need already. And talking about my future daughter, thanks God, hopefully it will happen. But I think at that specific time, I hope that sexuality, sexual health, contraception we'll be talking about it as open as we talk about other matters now. I believe that now there is an increasing and a growing common understanding about contraception and the benefits. If we invest in family planning, how much do we save? What does it mean to the community as a whole? So I believe that at that point, how old will I be? I'll be like 62. So that, I think we won't really be discussing whether they need contraceptives or not, because like the baseline is that every young girl will be, in my understanding, sexually active. And with the increase of technology use, I believe that access to information will probably be easier. Now the challenge will be, do they get the right information? Maybe we have now to develop new mechanisms for them to access filtered information and make sure they are getting the right information. And also, as a parent or as a dad, of course, I'll make sure her sexual life doesn't negatively impact her future as a 15-year-old girl, of course.
Great. I hope you have a daughter. We get to meet her then.
I hope I have two.
So, Honorable Minister Abdullahi, Ethiopia is very well known for its reach, and you had talked earlier about access to services and now the reach that is provided by the amazing Health Extension Worker Program. After 2020, do you see a continuing need for the health extension workers? Do you see that they would be doing things any differently than they are now towards universal access?
Okay. Starting from your question, I would like to even to express my stand from as a government. The first thing in Ethiopia, we had achieved tremendous achievement by using the health extension workers. So we are planning even to optimize the second generation health extension workers by giving them such kind of skills to capacitate their capacity by building a training. So we are even using the International Primary Healthcare Institute. So we established recently, before 1 year, by using this one, and even we can experience from the other countries. So I don't think to stop the health extension workers unless regarding to expand and to capacitate their skills and even to reach those who are hard to reach places. So this is my concern.
Thank you very much. And Fatimata, I wasn't joking about the Central Africa partnership that is still needed. That is the one region that has not been addressed by the whole international family planning community. So how would you organize it based on what you know about the Ouagadougou partnership?
Can you hear me? Yes, I think my my wish is to see this model of the Ouagadougou Partnership in the West Africa region be also put in place, set in place in Central Africa region and even in Southern Africa regions. And then to see how we can interconnect, those blocks and how those blocks could, work better with the global partnership, meaning FP 2020 Secretariat, so that gathering resources and knowledge, we can hit better, the ground, how this block could be in somehow, quote unquote, the technical arms of FP 2020 in general. So I think this could be something we need to think about while we are going through this process for consultation in terms of what could happen beyond 2020. So what we have started already involving Central African countries in Ouagadougou Partnership, not as member, but they are visiting, our countries, attending our key events, inviting us even to come and speak to them. And we have seen a lot of interest for them even to join the partnership. And we said maybe it's better that we have another platform or two others platform in Africa and interconnect them. So with the experience we have, we could, when it's time to build this partnership, is to invite them to come and visit us. We can go there and help them also, and provide them with our tools and lessons learned and expertise within the region so that they can take it very quickly. Thank you. That's very good. It's very welcome news that Central African countries are already becoming involved in the Ouagadougou Partnership. So we're going to open it for questions and answers from the floor, but I would just note that you've heard some important jewels of wisdom here, the coordination, the power of diffusion, of role modeling at the governance level, the power of reach with community-based worker systems, with commitment from the government, like in Ethiopia. You've heard about the importance of method choice, that is a long-term investment by many research organizations for the research and development of new methods, because different kinds of methods are important for different stages of the reproductive cycle, whether it's for males or females. And the importance of having a market, because we cannot rely on voluntary or philanthropic development of either methods or making them accessible and distributed at the country level to retailers and clinicians. So all of these four older panelists have now informed how Chris's daughter is going to have perfect universal access. She's going to be able to go anywhere she wants, to get any method she wants, with total information and with total security. And then she's going to become a prime minister somewhere.
President. Prime minister is low. President should become president.
But you're going to lead her into this, right? Right. So we'll open for questions from the floor. When you, there are roving mics, I believe, and when you ask your question, please introduce yourself and give your affiliation. Ellen, and then
check.
Over here, Ellen.
Sorry, Ellen. If everyone else could come to the mic stands that are located right here in the aisles, that would be terrific.
Thank you. Thank you very much. I'm Ellen Starbird from USAID. Thank you. to this panel. It's a fascinating conversation. I'd like to go back to some of the beginning points that were made about partnership, and particularly thinking about how to expand our partnership and engagement outside the family planning community. I think we've all indicated that that's really important going forward. I think it's been something we've been trying to do for many years and aren't very good at it. And so I wonder if the panelists have thoughts about how we do that better.
Why don't we take 3 questions and then let the panelists address them, please?
Thank you very much, Dr. Jennifer Mbabazi, and working with USAID Guinea. Thank you very much to the panelists for such an interesting discussion. I just wanted to go back to one of the challenges that was mentioned by Fatoumata, and that was the coordination of different players. And it mentioned that we've put in a lot of efforts, but we still have miles to go. And I was wondering, is coordination an area that can be pitched into FP 2020 and Ouagadougou partnership to help these different countries to kind of like up their game in coordination to reach the goals that we aim to achieve? Thank you very much.
One more question for this mic. Anyone? Okay, you want to start with those?
All right, so would you like to address the 2 questions? Anybody would like to go first? One was about partnerships.
As I said, I'm a strong believer in strong partnership, and I think we can expand partnerships to a next level. What we I think never done in the past is to come up with a strategic plan about partnership. If you put universal access in the middle and put around governments, consumers, manufacturers, NGOs, and what have you, and think about what can each of those organizations can contribute to universal partnership. You get an idea what the power of each is, and you can do a gap analysis what needs to be done to bridge from here to universal access. Then you can do calculation what is needed in terms of resources, financially, product-wise, advocacy-wise, what have you. Maybe this gives a better idea to unify all activities we have. Sometimes I have the impression we are still walking into silos. Each organization wants to achieve something. We never, I think, maybe I'm wrong, never thought about what is the next step we can do better jointly. Are we having the openness to talk to each other and say, look, I can contribute A, B, you may contribute D, E, and F. You know what I mean? I think to come up with a resolution. When you think about what is going now on in terms of global health is now a big issue in the health discussion. Has family planning a prominent role in global health? I guess not. It's all about oncology, it's about diabetes and heart diseases or cardiovascular diseases. And we have to think about how to get family planning within the global health discussion at a higher priority. That would be my wish for the future.
I think maybe to respond to Ellen's question about partnership, for those who haven't read, Ellen and colleagues at USAID did a great article in Global Health. She's shaking her head. It was a great article in Global Health Science and Practice about 2-3 years ago, which showed how family planning contributes to each of the 17 Sustainable Development Goals, and there's a very clear line of sight between that. I think the challenge that we have in any partnerships is that everybody wants to coordinate and no one wants to be coordinated. And so how do you break that cycle? And I think in this community, and I've been in this community now for more than 15 years, I think we have to recognize we're a pretty tough gang. I mean, it's not easy to get into our gang. If you don't say the right words in the right order with the right acronyms, in the right order with the right letters, you're not one of us. And I think if we really value what we care about and we really want to expand the partnership, we have to understand how other people think about this stuff and not just stand and shout louder until they align with us. And I think it's going to be tough for us to do. But if we really, really want to make progress, we have to understand other people's starting points. That whole adage of seek first to understand and then to be understood, as opposed to going in and saying, the reason you need to care about what we do is because of these three things, as opposed to saying, what is it that you care about and how can we help you to achieve your goals?
Thank you.
I think in addition to what my colleagues have said, in matter of partnerships, I wish different organizations, multilateral organizations, would really focus on improving or even kind of rethinking the way they partner with youth organizations. Because when you look at how and what young people go through to either get their work done or get funding, you may think that maybe organizations don't have really a structured way of partnering with youth, or maybe it may seem like they have to work with youth, but through other people, which I think at a certain point may restrict them from actually reaching the goals that they even want to achieve. Because if you were working through another organization, then it means there are certain rules and certain regulations that you have to abide to, which is very different if you are partnering directly with a youth organization. For instance, I was co-founder of the International Youth Alliance for Family Planning, and for the 4 years, so far, I think the Gates Institute has been very supportive for the International Youth Alliance for Family Planning, and I think you all have seen how much they've done to coordinate young people's participation to this conference. But if they were not given that responsibility, if they were not allowed to do what they want to do, I don't think we would have had the experience that we had in matter of youth leadership, in matter of youth-led activities at this conference. So I wish it moves from participating to conferences, speaking to plenaries, now to real actions on the field. Like having the young people in the executive positions, having young people in the leading positions in respective organizations across the globe that are working with youth.
Thank you. Very well spoken.
Okay, thank you.
Minister Abdullahi, do you have thoughts about either partnerships or other strategies that were raised?
Thank you. In generally, as Ethiopia, we have a lot of partners in Ethiopia. Those are doing a lot of things and even helping the community of the Ethiopia and the peoples of Ethiopia, even supporting us as a ministry. So if I explain from those, we had a lot of partners. Regarding on this, for example, the first thing we have to know how to mobilize and to use the resources that the partners are allocating. One, we can use in the technical support, they're skilled, and by transforming the knowledge to those, the communities, and one by using the constraints like a budget and the financial problem. So regarding on this, we have to first analyze the gaps and with the Ministry of Health, and first we need to assess how to fulfill these gaps and the resources and how to use these things. So as Ethiopian, we will like to support if all these partners are by helping the family planning. One of our constraints or one of our challenges will be the financial crisis, and one will be the advocacy, especially in the pastoralist areas and those who are not willing to use the family planning process. So this is how to manage.
Thank you. Thank you. And Fatimata.
So thank you for the two questions from Ellen and Jennifer. And as you know, with me, I'm passionate about, the partnership. Julia, you said it all. It's very difficult. It's to come with, different organizations, stakeholders with diverse agenda, with everyone want to have more credit than the others and one thing and the other. So very difficult, but it's not because it's difficult we cannot, try to make it happen. And this is what we try to do in the West Africa region with the Ouagadougou partnership. So I think at least if the donors can come up and agree with 2-3 things that they can do together. Not be even driving and going with their own bilateral programs and so. I don't think that we can go away of it, but how at least we identify 2-3 things to do together and then work it out and make it happen. But that requires also that at the country level we need a strong leadership. Without this leadership, we cannot really talk about, the partnership. And I think this is where we are thinking and keep thinking. It's an unfinished agenda, Jennifer. I agree with you. We have this partnership, working quite well at the global level, at the regional level, but sometimes difficult, at the country level. But I think we have started, seeing with the focal point that we have at the country level, and then the CIP being, the glue for this partnership and a tool that countries are using not only for programming activities, but also using this tool as an advocacy tool, but also as a resource mobilization tool. I think if really we continue and keep doing what we have started with this focal point, the discussion and debate, and the platform we are creating at the country level, I think we will be there. But I agree with you that we need to keep doing more in terms of coordination at the country level.
Thank you very much. I'm going to yes. So before you ask your question, and what I'm going to say probably won't change your question, it is that you've heard a lot of great ideas from the panelists here. What we would like to see is transformation, innovation, leadership, and positive disruption. One of the more famous new words in our lexicon, as Julia might mention. So I'm hoping that not just a question for the panelists, but also your own thoughts about what your vision is for after 2020. So please, we'll start with the gentleman who has the mic, but others, please provide your input.
Thank you very much, and thanks for a very illuminating discussion, which has given us a lot of thought for the future. A question that I had is, I'm Shumon Singupta. I'm the Asia Regional Representative for Engender Health. And Engender Health works to create access, to achieve excellence and create impact in the area of sexual and reproductive health and rights. And gender, youth, and social inclusion underlies everything that we do. So in this context, my question was that, or my comment is that, we cannot shift the dial. Even if you have the best products, if you have access, unless we address underlying social norms and gender norms. So what is your vision for us to kind of address those underlying gender and social norms, which will help us, I would say, eliminate underage marriages, teenage marriages, and possibly even eliminate teenage pregnancies, unwanted teenage pregnancies, and also which will enable men and boys to take responsibility, because it's the underlying gender norms which is coming in the way of this happening. And unless we can do this, my view is that we will not be able to shift the dial, despite the best products and despite having universal access. Thank you.
Thank you. And the next.
Thank you very much. My name is Muhammad Bumbida, of Muslim Family Counseling Services in Ghana. Also a member of Faith to Action Network, a network of faith-based organizations, multi-faith-based organizations. You can talk of Christians, Muslims, Hindus, Baha'is, all other faiths coming together to find a common ground in addressing family planning issues and also sexual and reproductive health issues. Now, I'm here to tell the world that faith-based organizations can be a very good ally in advocating for and on behalf of people. One key example is in Ghana, with the help of FP 2020 Rapid Response Mechanism, we've been able to advocate for the inclusion of family planning into Ghana's National Health Insurance Program, which is a very fantastic way of addressing issues of family planning, especially in rural settings. Taking it from Ouagadougou Partnership to FP 2020 and beyond, I am calling on you to keenly involve faith community, because they are with the people. I mean, there are a lot of myths and misconceptions, which is cultural, but people confuse it to be faith. And you can only get the knowledge from the faith-based organizations themselves. So I'm calling, it's just a contribution that faith-based organizations are advocates. They are very ready. For 2 years now, we've been following keenly, and we are ever ready to towards partnership and are ready to deliver. Thank you very much.
Thank you.
Good morning.
Good morning.
I am Dr. Nadira Sultana from Bangladesh. I would like to refer the morning discussion event and I'd like to coordinate with this great panelist discussion when you are talking about coordination, partnership, and alignment. In the morning session, there is a Bangladeshi presentation that how we are hosting the biggest humanitarian crisis in Bangladesh in terms of family planning and sexual and reproductive health. So actually, when we see beyond 2020, I would like to expect that the great panelists and others and the advocates, how they are going to stop and to help those humanitarian crises in terms of family planning, sexual and reproductive health, and overall the human rights of the people. Thank you very much.
Thank you. Yes.
Hello, my name is Aida and I work for Rutgers, which is a Dutch NGO. And I would like to focus more on, or to make the first question more explicit about the underlying gender norms that we need to address if we want to have universal access to family planning. Because, and I'm also looking at my fellow young person, as a young person, I think we specifically need to talk about young people as sexual beings, as young women as sexual beings, because everybody is of course denying that young people are having sex. And I would like to know to the young person, what do you need from adults in this to help them change that norm? And what do the adults have to offer to young people? Thanks.
Thank you. And yes. One last comment, and then we'll take responses. Yes.
I'm here
sorry.
for already a
on the
few
side.
speakers.
Please.
Sorry. My name is Jan Borg. I'm working for Enable, which is the Belgian corporation here in Rwanda. And I'm also a father of 2 adolescent daughters of 17 years old. Myself, I'm 62, so I went through the delinking of sex and reproduction. But I understand, and I compliment the panel with their views on beyond 2020, even up to 2050, I heard. I won't be around by that time. But, and I do agree, politics, policies, partnerships are necessary. But I want to make a point for radical thinking. I don't mean extremist thinking, but radical thinking. And I'm witnessing radical thinking in my family when I see my adolescent daughters using radical new opportunities for radical thinking, technology. Now, a lot has been said about including the youth in our partnerships, in our thinking about the future. But when we talk about youth, we talk about, in this conference, I have the feeling about youth above the age of 20. I would make a strong point for including and making part of our effort the girls and boys from 12 to 20, the adolescents, because I cannot even start to comprehend the way they communicate to each other and the way they think about about partnerships, about sex, about relationships, about family planning. Thank you.
Thank you. Provocative question. So would any of the panelists like to tackle the comments or the questions? There have been actually some very innovative, oh, I'm sorry, we have one more. So please.
Hi, thank you. My name is Liana Martin. I'm from the Danish Family Planning Association, where I work as a private sector advisor. Now, I've been here for a few days and listening to a lot of different and interesting perspectives. But one stakeholder that I'm missing in the conversation is corporates. And I'd like to ask the panel, how do you see the role of corporates in terms of accelerating progress and integrating sexual and reproductive health and rights in the workplace at a strategic level, looking at policy development and implementation? Thank you.
Thank you. And your question was about the corporate sector?
Corporate sector.
Okay. Well,
agriculture, textile, the private sector.
More industry.
Industry, yes.
Thank you.
Thank you.
So responses from anybody up here?
Yes and yes and yes.
We heard some really good complementary insights to what the panelists had, the importance of changing norms and involving, we've been hearing about involving men for many years, but truly engaging men. And I have to say, I think at this conference we've seen much more of it, along with youth. And we also heard about involvement with faith-based organizations, which is also important and speaks to what Julia had said in terms of being able to cooperate beyond our comfortable zone, the border, the community with which we're comfortable. But the comment also about the corporate sector industry, I don't know if any of you would like to quickly respond, add to these.
If you want, on the corporate one, there have been some presentations, and I think it's something that we see such enormous potential, and much of it's already happening. The Population Council has been doing research in Bangladesh and in Cambodia with companies working mainly in the garment sector, which obviously employs a high proportion of their workforce are adolescent young women and girls. And we organized a session during the UN General Assembly in September with a number of corporate partners, including some very big names, Danone and Walmart, and I'm going to forget all the others. But they are doing incredible programs with organizations like the UN Foundation, with a business to social responsibility, providing workplace programs. And often we think that, yes, they're not the poorest and most marginalized populations, they are in employment, but actually when you think about the realities of their lives, they're often working very long hours, they don't have access to the public health sector during the time that they're working, and the potential to be able to provide services where people are and not expect to have people to come to services, I think could be a real game changer as we think about the limited resources we have, not only financial, but in terms of human resources for health, actually taking health services to workplaces. Some of these factories are employing thousands and thousands of women, I think could be a real game changer. So I think that's something we absolutely should be exploring more moving forward.
Klaus, did you want to add something?
I think there will be a need to involve countries more when we talk about development. And Julia mentioned about maybe new avenues for more contraceptive methods. I think the national authority might ask for data with their own population, so we have to think about more global programs in terms of development work from a scientific and research perspective. This is not such common for reproductive health products today. When you look into other therapeutic areas, you have to involve more and more countries. This is an advantage. The disadvantage is it will take longer times to get a registration or to file a registration. So we have to balance a little bit about what is needed and where needs to be done some more research, and maybe to build research centers in countries like Middle Africa or in Latin America or in Southeast Asia to better understand the needs of the population in those countries. I think this is something where industry can help to give support.
Thank you. So we've come to the end of this session, and it has been a very rich discussion. It may be for the next to the last person who made a comment about how youth will communicate in the future, that should this type of session be held again in 2020 or 2022, it'll probably be done on WhatsApp through Instagram posts, and is also using emojis rather than all of the narrative that you've heard this morning. But thank you very much to all of our panelists for your insights and wisdom. And thank you to the audience for your comments as well. And I think you should keep voicing and articulating what you see will be important for after 2020. And we wish you all the success, and we hope we will all be there to see it and experience it. So thank you.
When postpartum women are asked about their desires for another pregnancy, the vast majority prefer not to become pregnant again quickly. Yet, in the first year or two postpartum, only a third of these women will use a modern method of contraception to fulfill their intention. Women can get pregnant before their menses returns. Yet, many women wait for this as a sign to even start considering their contraceptive needs. Currently, about 1 in 5 married women across the 69 FP 2020 countries want to prevent or delay their next pregnancy, but are not using a modern contraceptive method. We will need to work together and intensify our efforts to meet the family planning needs of women and couples who want to space and plan their pregnancies. How do you achieve this goal with postpartum family planning, or PPFP? There are many opportunities to reach women and provide better information and integrated services during pregnancy through antenatal care at clinics or community home visits, during childbirth and early postnatal care, and during immunization or other health visits. There are many ways for women and couples to practice PPFP, and numerous contraceptive methods for them to voluntarily choose from, depending on their needs and preferences. Rwanda has been a leader in PPFP, starting small and expanding rapidly in the past 3 years. A recent analysis shows that more women would voluntarily use contraception if Rwanda continues to expand PPFP services. Once PPFP services are widely available throughout Rwanda, maintaining services would cost less than 1% of the government's annual health spending. Rwanda has committed to scale up providing PPFP to all facilities in all districts by the year 2020. This relatively low-cost investment is likely to bear returns for a lifetime. If more women and couples adopt an effective method of contraception before they risk becoming pregnant, then there will be fewer unintended, closely spaced pregnancies, which means better health for mothers and children, more time for women and couples to focus on their children and engage in productive activities, which means higher income for families, leading to economic growth, development, and more stable and secure nations. We call you to action to meet the needs of postpartum women. Examine your programs currently reaching pregnant and postpartum women, whether in their homes, in communities, or in health facilities, and see how you can go further to inspire others, create change, and meet the needs of postpartum women. When postpartum women are asked about their desires for another pregnancy, the vast majority prefer not to become pregnant again quickly. Yet, in the first year or two postpartum, only a third of these women will use a modern method of contraception to fulfill their intention. Women can get pregnant before their menses returns. Yet, many women wait for this as a sign to even start considering their contraceptive needs. Currently, about 1 in 5 married women across the 69 FP 2020 countries want to prevent or delay their next pregnancy, but are not using a modern contraceptive method. We will need to work together and intensify our efforts to meet the family planning needs of women and couples who want to space and plan their pregnancies. How do you achieve this goal with postpartum family planning or PPFP? There are many opportunities to reach women and provide better information and integrated services during pregnancy through antenatal care at clinics or community home visits, during childbirth and early postnatal care, and during immunization or other health visits. There are many ways for women and couples to practice PPFP and numerous contraceptive methods for them to voluntarily choose from, depending on their needs and preferences. Rwanda has been a leader in PPFP, starting small and expanding rapidly in the past 3 years. A recent analysis shows that more women would voluntarily use contraception if Rwanda continues to expand PPFP services. Once PPFP services are widely available throughout Rwanda, maintaining services would cost less than 1% of the government's annual health spending. Rwanda has committed